I bought the practice in 1996 from Dr. H.R. Dietz. So this is a legacy practice, and I've been at this location ever since, so since 1996. When I came to town here because I was looking for someplace close to home. And Dr. Dietz was looking for somebody and had been interviewing many people in order to take over his practice. And for some reason he liked me, so I ended up settling here in Dover. I met my wife 3 years later. She was a blind date, and I was surprised to see that she could see. My daughter is in high school currently. She's a singer-songwriter. She has a lot of interest in the medical field as well. And she works here part-time at the practice. One of the things that makes us unique is that we are a fully comprehensive practice. That means I do everything from basic restorations, treating young kids, all the way to young children as old as 102 years old. I'm also an orofacial pain specialist as well as a general dentist. We do a lot of questionnaires to begin with that deals with the history of pain, your description of pain, some of the psychological aspects of pain, sleep screening, etc. And then we will do a thorough interview and understanding what type of pain that patient is experiencing, because often there are multiple different types. And then the physical examination is a detailed physical examination, and sometimes we do different tests and techniques to help hone down the diagnosis. My whole entire process, my whole entire mode of operation, if you will, is to involve the patient through co-diagnosis. In other words, helping the patient to understand what's going on in their mouth and in their regarding pain, or whether it has to do with their general dental condition. And how does that apply to them? And then what options are there for treatment if in fact they want to have treatment done? So I view myself as more of a coach, where I will educate them about what's going on in their mouth, let them know if there are problems, and then what the solutions available are to their problems. And then listen to them and listen to what they tell me and ask a lot of questions so that I can then build a treatment plan that's appropriate for them. So some of the technology that we use in our office is what's called a cone beam CAT scan, which allows us to take three-dimensional images of the jaw, the skull, the teeth themselves. We can actually take a full head image, or we can just hone it down to 3 teeth or 2 teeth to look at the teeth in 3 dimensions. That same unit also allows us to take external bite wing x-rays. We also have 3-dimensional CAD/CAM technology. So what that allows us to do is to fabricate crowns in a single day. So tooth-colored ceramic crowns in a single day, or even large fillings. Sometimes we'll do using milling technology in one visit. So it allows for a much better restoration, a lot more contour, and we can actually copy the shape of the tooth and the contours of the tooth that patients come in with. One of the areas of expertise that I have is, and one of my loves actually, is complete denture therapy. Actually, in 2022, I published a textbook on complete dentures with a colleague of mine from Arizona who is a prosthodontist or a specialist in reconstruction. It's the art of complete denture therapy for the general practitioner. For many years, I've been doing a lot of my own denture work here in the practice. I have an in-house laboratory where I set the teeth and do a lot of the behind-the-scenes thing, which really gives us control of the dentures. And so we have a lot of patients who are very pleased with the denture therapy that they've had over the years. Our motto in this practice, in everything we do, is centered around one philosophy, and that is that we are here to help you have healthy, comfortable, and beautiful smiles for the rest of your life.